So, urinary incontinence is one of these areas where we have a lot of really good evidence and a lot of strong research about what works and doesn't work. However, much of it is still being integrated into practice. Right now, although I think it's getting better, oftentimes more is known about the treatment of urinary incontinence than is currently applied in practice. And incontinence is high throughout the world. It affects, in America alone, 17 million Americans. Women are more likely than men to have problems, and certainly our elderly struggle with this issue a lot. About half of frail elders who are homebound or living in nursing home or long-term care settings struggle with some form of incontinence. This is an increasing problem as people grow older, and again, as I mentioned, very common for women, particularly women who are moving into their 80s and 90s and their age. Their risk of incontinence goes up dramatically in that time frame. So UI and falls are the leading reasons for nursing home admission, and I think this is a really important point for you to be able to take away. Incontinence oftentimes becomes very difficult for the person and caregivers to manage at home, and the risk of falling or the health consequences of falling, often on the way to the bathroom, are often a sort of a sentinel event, if you will, for families realizing that they need help in managing these problems. Now, there's some interesting information that we do know about continence in long-term care settings. We know that about half of residents are incontinent of urine on admission. And we also know that within 3 months of moving into a long-term care setting, that the residents who were continent on admission, half of them will go on to develop bladder symptoms, including urinary incontinence. And the issue here is that given the number of people who struggle with incontinence in long-term care settings, we know that only about 15% ever receive any sort of assessment, and out of those, only about 3% receive any kind of treatment. And there's some studies that even show that those treatment percentages are as low as 1%. What is concerning is that almost 100% of the residents wore absorbent products. So one of the takeaways that I want you to start to think about here is that while absorbent products are a tool for helping residents gain confidence with bladder control and for management, they are not the solution. And they are not the only thing that we should be offering our patients. If you're in a setting that also has a CBRF and assisted living component, recognize that about 15 to 30% of those older adults are also struggling with incontinence in those settings. So this has a significant impact on health status. We know that people who have urinary incontinence are much more likely to experience depression, isolation, and low self-esteem. We also know that skin breakdown is more common, that urinary tract infection, that risk goes up, as does falls and fall-related injuries. And there is significant psychological sequelae that are associated with incontinence. And you can think about this. You know, it's one reason why people don't often share that they're struggling with their bladder function. Because they're embarrassed, or they feel guilty, or they just feel like it means that they're becoming more dependent, and so as a result they will change behaviors in an attempt to manage and cope with these problems. And so these are our elders who are limiting or dropping out of social situations. They might quit going to bingo. They might be the ones who all of a sudden don't want to eat in the dining room anymore. Those kinds of sort of clues are ways that they're attempting to cope. Incontinence is also very expensive, and even though this is an older study that's cited, we know that the costs have not gone down. And we know that about half of the money that Medicare spends on the management of incontinence is spent in pads and laundry. We know that about half of it is spent on the expenses that incur following any sort of adverse consequence related to a urinary urinary incontinence. So think about the elder who falls on the way to the bathroom and fractures a hip. Think about the person with incontinence who is experiencing skin breakdown and is at risk for pressure ulcers. Think about the person who is having recurrent urinary tract infections. And yet we only spend, as we mentioned, a very small portion of this on evaluation management. And it really does cause us to ask this question: why are we not more focused on evaluation and management? We're really still being very reactive and kind of addressing the issue after the fact, if you will, when there's many things that we as nurses can do proactively to not only address this issue but improve quality of life for the residents that we care for. Medicare feels this way also. And one of the things, if you're new to long-term care, you may not be aware that Medicare does issue surveyor guidances, and surveyors are part of the quality assurance arm of Medicare, and each state has these surveyors who are responsible for coming into nursing homes and assessing the quality of care that's being provided. And so you'll hear a lot about survey and the surveyors and when they're due to come and those kinds of things. And so one of the things that Medicare did is they updated and have issued a surveyor guidance specific to incontinence and catheter use. And you can find that at your facility, and in the resource packet that I've given you, I've also given you an article that discusses exactly what this means and how to interpret it. But the overall goal is to improve the care surrounding incontinence and reduce the cost. And so what they're asking in this guidance is that nurses are able to identify those residents who have incontinence, that they're able to do basic assessment and evaluate the response to treatment plans that might be offered. Also being able to individualize the care plans and make sure that nursing interventions are being implemented that are specific to each resident's unique circumstances.